City authorities in Sekondi Takoradi say they have been left with no other choice than to shut down markets there. The tagging of the city as an emerging hotspot is said to have also unnerved residents. Correspondent Natalia Quanta has more in this report.
Takoradi is now being cited as the new hotspot for the spread of COVID-19. The city, together with mining town Tarkwa, are now top on the list of places where the virus is spreading like wildfire. Residents are alarmed at the news.
You don't know who is carrying it, and so you have to be very careful with yourself. So that is what we are basically doing, making sure that we adhere to whatever thing that the government has brought to us. So if you go to town, you see that the town is very quiet.
Well, now you are even scared to go out. You are scared to go out. The hospitals, when you go there to the hospitals, you realize that the patients are not even coming. They are not coming. And I ask myself, why is it that now the hospitals are not recording patients as they used to? They are scared. The staff are equally scared.
This is the famous market circle in the heart of the Western Regional Capital. Its packed alleyways and stalls are now being blamed for the spread. City authorities are contemplating shutting down the trading center as many calls for social distancing have fallen on deaf ears.
This market circle, Takoradi here, has become it's one of the notorious areas that we have this social distancing not being adhered to. Yes, somebody decided to decongest this market by sending some of the people to the Jubilee Park so that the market will free up. People can move easily and have the social distancing practice here. But you can see and you can call that since yesterday that we were here, in the evening 5 o'clock we were here, they came back again. They were selling.
In the Western region, at first when it started, we started with one, it went to, and it went on and on and on and on and on and on.
The Ghana Health Service says it is deploying men to the area to find out what the problem is and how to tame it. But in the meantime, the city and its people continue to live in fear of this deadly virus. In Natalia Quanta's report for Joy News.
And joining us on phone is the Western Region Health Director, Jacob Mahama. Thank you very much, Mr. Mahama, for making time to speak with us. Now, what is accounting for the surge in cases in the region?
Yeah, there is a surge in cases in the region. It's partially due to we now doing our own testing. We had a very big backlog. So what you're seeing is just the accumulated figures. It's not that the figures have just come all of a sudden, but they are samples that have been kept for a long time. And now we are able to test in our region. That is why the numbers are going up. So that is the main explanation. When we send our samples to Accra in cases, but the Ghana before they came. And now we started testing in Takoradi itself, in the veterinary lab.
The Ghana Health Service.
Hello?
All right, but I'm saying that the Ghana Health Service is the Ghana Health Service. The Director General has been speaking about it, and it is worried about the surge in cases. Are they not aware that it's supposed to be a backlog, like you're saying?
They are aware. The backlog is there, and then the records are there to show that there was a backlog. And then we are not testing. That might not be the main reason, of course, because maybe there have been some one or two reasons why it has gone up. But the main reason is because the backlog is being cleared. And you see, one year you can have about 58, 30 cases. That doesn't mean that they all got infected at the same time. There's a backlog that we are now clearing. Hello?
But the Ghana Health Service, again, is sending some personnel over to the region to come address the situation. Does it mean that their visit is not necessary?
Oh, it is necessary. Why is it not necessary? Because they're even running out of reagents and pipettes. And when they come, they will see for themselves. We are working together with them.
So you're expecting them to come, but you're more interested in the reagents and the things you're running out, not so much because they can help solve the surge in cases, which you say is a backlog.
Two heads are better than one. when they come together, maybe there will be something that we didn't actually notice. But we all knew that it's because people are not keeping the protocols, the preventive protocols. Not only Takoradi, most people, most regions are also experiencing the same thing. But I'm saying that this sudden surge in numbers is because of we are clearing the backlog. I wish you could have been connected to the lab. They will tell you what they're doing. They run 24 hours shift just to clear the backlog. And at the time we need to send, we even had to send thousands of the samples to Accra vet lab to have them done, because it's not easy waiting for a result when you don't know whether you're positive or not. So we try to actually clear the backlog so everybody knows his or her status. And like I said, that might not be the main reason, but there are other reasons that might actually accounted for the increase in numbers. But we at the regional health director know it's because of the backlog and at the laboratory.
All right. Have you been able to clear the backlog now, or there's still some more?
No, we still have over 2,000 samples to be cleared. We have over 60%.
So it's likely there are going to be a few more cases.
And then we had 4,000 done. And then we still have about 2,266 backlog, which we are working on.
All right. Thank you very much, Jacob Mahama. Jacob Mahama is the Western Region Health Director. Back to you, Anne.